After our first investigation, where 4 Obamacare workers were decertified, placed on leave, or terminated, you may remember our second series of videos where Obamacare Navigators also told us how to defraud the IRS.
Stuff like that, to get a lower premium, I wouldn't include, if I was cutting grass on the weekends and they were just giving me money, that's my money.
Yeah, exactly.
So, that's my money. That's my money.
Now we follow up with those employees and we release some new locations of Obamacare Navigator fraud. First, we visited Change Happens, an organization that had received $785,000 from the federal government to conduct Obamacare enrollment, to see how they were handling the statements from their employee Kris McKray. We found out they appeared to have fired him. Someone's coming down. He said that Kris McKray was not here, which we don't know if is true or not, but he's bringing someone down to give us a statement. Hello. Yes, James O'Keefe.
Okay.
Project Veritas.
Okay. Actually, you can't come into the building because you don't have an appointment, and Kris no longer works here.
Kris no longer works here?
No.
Was Kris fired?
He was let go, but he no longer works here.
So Kris was let go from this organization?
Yeah, so you can leave.
So Kris McKray was suspended or terminated, or? So Kris McKray no longer works
He no longer works here.
What happened with Kris McKray?
I'm not exactly sure, but you can come out as well.
Did we get a statement from the organization about the statement?
No, it's not my business to tell, but you can come on out.
Can we get a statement from the organization about what happened
No,
in terms
he
of?
no longer works here. That's what I was told to tell you.
Okay.
But he's not an employee here at Change Happens anymore. So you can leave.
He's not an employee anymore?
No.
And is there any statement that you guys can give us about that, or? I don't want to be stick around here too long. We're trying to get answers, but we'll have to follow up with the office, with the corporate communications. Unfortunately, this is one of the reasons why journalists can't get through to these people, because they don't answer their phones. Even when you talk to them, they won't give you clear answers. But Project Veritas reporting now that apparently Kris McKray has been terminated from Change Happens. You heard it from Melissa, one of the employees here, and we'll be following up shortly. Then we visited the East Dallas Health Center, whose parent group, Parkland Health and Hospital, received $147,000 in an HRSA federal grant. They told us they had gotten emails after we visited one of their financial planners, Maria Castro, who told us how to commit fraud with the IRS.
I'm going to tell you something.
Okay.
If you claim that other half on your taxes.
No, I don't do
so
that.
then don't add it.
Don't add it? Okay.
But do not add up if you're working and doing barber and getting the
Don't add that
Because
to,
if you don't claim that on your taxes,
then there's no proof.
there's no proof.
Hello.
Hello, how you doing? Let me clarify. Who is that?
I'm James O'Keefe with Project Veritas. I'm looking for Maria Castro. And this is Lawrence Jones, my colleague here.
How you doing?
And,
Okay, so Maria Castro.
Yes.
She is a financial counselor.
Yeah.
She's front desk person.
Oh.
So I just want to make sure that we had the correct.
Now she was a financial counselor who was encouraging Lawrence to lie about his income, not to report income to the federal government.
Really?
Yes. Yeah.
Wow.
Isn't she a navigator? Because you were here the last
I just want to
time.
make sure that we had the right person.
She was encouraging Lawrence to lie, and she was telling him to lie about his health status to get more Obamacare subsidies.
Yeah, we got an email regarding that. And
You got an email regarding it?
Yeah, I was saying, it hurts the black community when they take different programs and they're incentivizing people to go and commit fraud. That's not what the program was made for.
No, and I'm pretty sure her supervisor knows she
Exactly,
stated
exactly.
that.
And you're familiar with the investigations we've been doing into Obamacare?
Corporate communications.
Okay. Can you confirm what was your name again?
I'm Sabrina.
Sabrina?
Yeah.
Can you confirm what she said in regards to the emails were sent out about Project
I
Veritas?
can confirm that you need to speak to corporate communications,
Okay.
please.
Okay.
Thank you.
Thank you.
Have a good day.
Thank you. As we were walking out, we got stopped by a police officer before we entered the elevator.
Hey guys.
Hi.
What's going on, man? How you doing?
They're just on their way out. They've already been referred to corporate communications.
We got a lot
So I
squared
assume
away?
that's where they're on their way to.
Good deal. Okay,
And my name?
that's right.
James O'Keefe. We do reporting on the enrollment process into Obamacare. So.
Yeah, is it looking good or is it looking
A
bad?
lot of fraud. A lot of people trying to defraud the federal government. And this location, they were trying to defraud the federal government
Oh, really?
by lying about income.
Do you remember the Acorn takedown? Yeah,
The pimp and the hooker going in.
Oh, was that y'all?
I was a pimp. Yeah.
Dude, I followed that story. That was cool.
Yeah. Then we visited the North Texas Area Community Health Center, which received $139,000 to conduct Obamacare enrollment. Obamacare Navigator Claudia Flamon had counseled us not to worry about our side income.
Do you report this on your taxes?
No, I don't report them.
Don't worry.
First, we confronted Claudia.
Hello, how are you?
Are you Claudia Flamon? Yes, hi, I'm James O'Keefe.
I can help you. I have the private information for the lady.
Project Veritas, we do investigative reporting. You spoke with Lawrence Jones not too long ago. Do you remember the conversation you had with Lawrence?
Yeah, but I'm helping this lady in this minute.
So when you finish with it, you mind stepping out and talking with us? We can wait for you.
I don't know.
Oh, she's still here.
Then we went inside to get answers from her staff. We tried to get a comment from the staff at the location, but they kicked us out and locked the doors.
You need to go back outside.
What is happening to Claudia?
You need to go back outside.
She's still working
You need
here?
to go back outside.
She receives
You need to
federal
go back
money
outside.
and
I'm
she's
sorry.
still working here?
I'm sorry.
What are you guys going to
Can we
do?
speak with the CEO?
Okay, you need to go back outside.
All right, we have to leave. Come on, let's go. What's going to happen to Claudia? There's any disciplinary action being taken, or?
Okay, then you need to get out.
Not all locations were hostile. The United Way of Tarrant County receives the most grant money from the federal government, $5.8 million. A staffer there told us she supported the work we were doing.
Well, you guys do good work. I do appreciate what you've done. And
Thank you.
I will get a hold of Tim as soon as I can and reach out to you.
Which led us to the United Way Partner AIDS Outreach Center, which receives funding from HRSA, the Health Resources and Services Administration, a department of the U.S. Department of Health and Human Services. Supervisors at the organization told us they volunteer to do certified application counseling. We showed the two staffers the undercover footage of Tom Berwinger, director, telling us how to defraud the IRS.
We're not getting any
We're not getting any money for
revenue for doing the certified application counseling.
But that's something that you do. Certified application is done through
voluntarily.
voluntarily work.
We mandated that all our direct service staff get certified so that any one of them can help anybody who walks in the door.
With the enrollment process.
With the enrollment
Obamacare.
process.
And who certifies you? Who certifies your organization?
Well, that's through an agreement we made with the government, but it's totally separate from our grant funding for HIV services. Again, United Way here locally received a significant amount of money for navigation, but because of so many that they thought that they would never be able to reach with the 6 navigators they have, they asked several of their partner agencies, including us, the Aging and Disability, and other, I think it's over 25 partners, to please help and assist. One way of doing that is to become application counselors.
I want you guys to see the video.
You know, I have my regular job that I do.
Right.
And then I do some stuff on the side. I have, I'm trying to do a small business, got a hotline, that I do on the side to,
Do you claim it at all?
No, I don't claim it on on my taxes. I mean, something's starting. I got a couple ladies,
I wouldn't. Yeah, as long as you're not claiming it,
Yeah.
it ain't gonna come up.
It's not gonna come up.
The only thing that's one of the things that we read about was the IRS. It's called Hub. You put that information in, it goes to the IRS,
Yeah.
and then it goes to a couple other organizations,
Yeah.
like if you have a house or whatever, and then they'll figure it out that way. But if you've never claimed it on your taxes, they wouldn't know.
They wouldn't know about it. What about, some of my girls they're smokers, but I wouldn't consider them smokers. They might smoke a pack a week. Do you think they'll test them, or do you think it'll pop up?
No, I think it's more on verbal, like if you say, yeah, I smoked so many years or something like that.
Yeah.
Because there's not really a way of testing. I mean, there's not a nicotine test.
Mm-hmm.
But if they go see the doctor and they answer the questions,
Yeah.
that goes into their medical records. Or if they had seen a doctor before and they told them that they smoked, then it's in your medical records, and they can get access to those medical records.
Okay. That's good to know.
You can always say you quit 2 years ago, yeah, no, I don't think you'd be penalized on that.
Yeah.
Because I'm sure a lot of people probably.
Exactly.
Yeah.
They don't provide for part-time workers. They don't have
work you do.
Well, I'm telling you about my side thing that
Side thing, I would just kind of keep real quiet.
Yeah, that's what I'm gonna keep.
If you're not dealing with the city or the state or the taxes, I wouldn't write them checks. You pay them cash, right?
Yeah, I pay them cash.
Yeah, all that. I keep that quiet until something comes along. You know what I mean?
But as far as like that part-time, you'd probably be able to get really cheap insurance.
Okay,
Because you're
okay.
making so little.
So obviously telling him to keep it, quote, real quiet, unquote. You know, I know Lawrence, you had a comment about that.
Yeah, tell me to keep it real quiet, to pay in cash. And so my question to you as somebody is the executive director, do you think that it's okay for, this program was to help communities like the black community, my community. Do you think that it's okay for certified, you say counselors, but he portrayed to me that he was a certified navigator, to defraud the government?
Absolutely not.
That it's okay
Never.
to
No.
do this?
Absolutely not.
So seeing this, and we're going to release the full video so you guys can see everything, but just seeing these clips, do you think this was okay?
No, absolutely not.
No. No, it wasn't. And we have huddles every Monday morning. We didn't have one yesterday. I was out sick, but every Monday morning we have huddles. And this is the reason. It's because it's stressed every single meeting to provide factual information only. So clearly this is disregarding that instruction. But in every meeting, we tell them that each individual makes their own choices based on factual information, that we only are to provide factual information.
So can we expect any type of discipline action to be handled for this type of situation?
We'll need to investigate it. Absolutely, if there's wrongdoing, there'll be disciplinary action as there is in any violation of practice, procedure, rules, regulations.
Stay tuned for more updates from ProjectVeritas.com.